Good afternoon, friends, and welcome. For those of you who do not know me, I am Dr. J. Keith Motley, Chancellor Emeritus and Professor in the College of Management at the University of Massachusetts, Boston, and Consultant President and CEO to the Urban League of Eastern Massachusetts. This afternoon, we are celebrating our pandemic heroes in a virtual format out of caution and respect for those of you who aren't ready to gather in person in consideration of the challenges that COVID presents. This is the 101st year since the founding of the Massachusetts Health Council. 101 years of great work serving the people of the Commonwealth through their commitment to improving and protecting health for everyone. The mission of the Mass Health Council is to keep residents of the Commonwealth healthy and thriving. In this celebration, we honor those who have been on the front lines in this pandemic. We want to celebrate the countless men and women whose jobs put them in harm's way every single day. Every one of these heroes got their jobs done while the rest of us were home trying to figure out how to navigate life and keep our loved ones safe and healthy. We thank you, and we want to honor your bravery, generosity of spirit, and selfless dedication. I want to introduce the CEO of the Mass Health Council, David Martin. Now, David is no stranger to healthcare advocacy, having worked in the legislature, the executive branch, and several of the Commonwealth's most prominent healthcare institutions. David knows healthcare, and David knows advocacy, and we all do well in his care. I am happy to call him a friend and champion for a healthier Massachusetts.
Dr. Motley, thank you for that introduction, and thank you for joining us to help us honor these amazing people. But especially, thank you for your leadership in education, equity, and social justice. Each year, the Massachusetts Health Council is proud to recognize leaders from across the state who help advance what is the central mission of the Mass Health Council, creating the conditions that enable people and communities to live healthy, thriving lives. Our honorees this year are leaders and medical professionals and researchers who have helped Massachusetts navigate this global pandemic. But there are many heroes that deserve to be recognized, and we want to start by paying tribute to the invisible heroes that came to work every day and did their jobs so that many of the rest of us could stay home and try to keep this pandemic at bay. Emergency medical personnel, nursing home and long-term care employees, grocery store employees, teachers, pharmacists, and many others. These folks showed up every day so that the rest of us could be safe. We owe them an enormous debt of gratitude. Please watch this moving video tribute to the visible heroes all around us.
The pandemic changed everything. From the dawn came heroes, worthy of graphic novel legends. Teachers reaching students through computer screens, homeschooling moms and dads, the people we see, but don't really see. Heroes every day. The heroes among us. They got up, they showed up, they rose up. They didn't stop, they just did what they had to do.
Ambulance service assignments reported. How can I help you?
Answering the call in March 2020, EMTs and ambulance services never missed their stride, helping here at home and answering the call to help brothers and sisters on the front lines in New York City.
It was scary at first, but it was amazing to be part of something bigger where all of EMS across the country came to help one city out that was suffering.
You know, initially we thought we were going out there for 2 weeks, and then after about 8 days, we were asked to stay for 2 more weeks for the whole month. And our entire team, we were tired and scared, but we all signed on and we stayed. I've never felt a stronger team aspect than in that moment, because it was somewhere I've never been before. I didn't know the people, and we didn't really know what was going on, but we had no hesitancy to stay longer.
There were personal sacrifices of our hero families.
We found out my wife was pregnant in November of 2019. COVID came around in February, March, and my wife, she works in the emergency room, she works in registration, so she was around a lot of people all the time. I myself was on the ambulance, so I was around with people all the time. We had actual COVID cases that I was feet away from dealing with that were very sick patients, so we had to be extra cautious because we didn't know what the effects would be on a pregnant female.
In the nature of being a first responder, you get up in the morning, you put on a uniform, and you respond. You go out there and you work hard. My husband, after getting the vaccine, the 2 doses, got the COVID variant, Delta variant, and it was a rough 2 weeks. When you go home and you spend time with your family, and you live in a world that you help create, the world that you help protect.
These are the heroes in times of crisis. There are also heroes we need every day.
During the pandemic, I did not miss a day's work. For me, it was important to support the people I work with and the customers. The customers going through their rough times too. The store went from being busy to really, really, really busy at the beginning. People were afraid food was going to run out. Toilet paper, you know the whole toilet paper episode. People were trying to find whatever they could, cleaning products. So I felt we needed to be here for them.
We work very well together in this store, and we're all hard workers, and we continue to do that. And we just went on and just kept on working like we normally do. We have to live our lives. We can't live in fear. We can't live indoors. And I was really thankful I was able to work through this whole pandemic.
Pharmacies like Walgreens had to shift focus at the pandemic start to make sure that patients got their medications that they needed to stay healthy. Pharmacists not only delivered medications, they became the front line to help contain and fight COVID with on-site testing and delivering vaccinations. These pandemic heroes will help us see the light at the end of this pandemic tunnel.
COVID-19 public health emergency has created unprecedented challenges for all of us. And I believe that our response to managing this pandemic has been selfless, courageous, and awe-inspiring.
Continue to be vigilant. We need to continue to support each other. And when this is all over, and it will be, we need to remember those frontline staff members who put their lives on the line every day to take care of our patients.
I think that is really powerful. And now we want to move to the award presentations. Keith, back to you.
Thank you, David. The Shining Star Awards distinguished honorees tonight are all leaders in their fields of expertise. The light that we shine on them should be considered a much larger light that shines on all of the professionals who rose up to help lead the men and women of the Commonwealth and, in some considerations, the rest of the world through the perils of COVID-19. Every year, the Massachusetts Health Council honors leaders in healthcare and business for accomplishments that make Massachusetts one of the healthiest states in our country. Massachusetts has emerged as one of the leaders in vaccination rates in the country, and that we should be very proud of. Governor Charlie Baker appointed Marylou Sudders to be our Secretary of Health and Human Services in January of 2015. When the Baker-Polito administration launched the COVID-19 Response Command Center in March of 2020, this was the team selected to lead Massachusetts through the pandemic, and this team was to be led by Secretary Marylou Sudders. The COVID-19 Response Command Center was established to serve as a single point of strategic decision-making and coordination for the administration's comprehensive COVID-19 response. To present this award, here is our governor of the Commonwealth of Massachusetts, Charlie Baker.
Hey everybody, this is Massachusetts Governor Charlie Baker. I want to say thank you to my friend Dr. Keith Motley for that introduction, but I also want to thank you for all the great work you've done on behalf of so many people and causes over the course of many years. I'd also like to thank the Massachusetts Health Council for their steadfast leadership and guidance over the last year and a half. This organization's been critical to the recovery and resiliency of Massachusetts and many of our cities and towns as we've combated the COVID-19 pandemic, and your partnership throughout has been invaluable. It's an honor to be with you all this evening, even if it's virtual, to celebrate some of the smartest and most compassionate and resilient people we know, as well as honor the countless essential workers who day in and day out since March of 2020 put their own lives and health at risk to ensure that the rest of us were safe. Without your tireless support, courage, and hard work, Massachusetts would not be in the position it's in now when it comes to COVID-19. On behalf of the entire Commonwealth, I want to thank you. We're immeasurably grateful for all that you've done and continue to do on behalf of our families and our communities. In addition to the hard work and dedication from essential workers, our Commonwealth's progress in the fight against COVID-19 would not have been possible without a lot of folks, but especially one in particular, Health and Human Services Secretary Marylou Sudders. I've known Marylou for many years. She and I worked together back in the 90s, which at this point seems like it was a million years ago. But the one thing you should all know about her is she brought it all to the fight against COVID. And I've said many times that Marylou is the kind of person who does not quit. And in a time and a circumstance where facts were changing, information was changing, data was changing constantly, she was one of those people who never threw up her hands, never stuck her head in the sand, and just fought all the way through every single day on behalf of the people of Massachusetts. And I think a big part of the reason why we're where we are with respect to COVID has to do with the work that she did over the course of the past 18 months. So to you, Marylou, who I obviously was side by side with on so many of these occasions in the past 2 years, congratulations, God bless, and I'm really glad that you said yes once upon a time when I asked you to join our administration. I also want to say congratulations to all of tonight's honorees, and I want to thank all of you for your commitment to the health and safety of the residents of Massachusetts, and in many cases to the people you work with day in, day out as part of your employer community. I also want to say how much we appreciate the fact that so many of you gave so many hours and so much time to fight this battle against COVID. And you too have a lot to do with why we're where we are today. You know, when I talk to the people in the Berkshires, and I talk to people on the Cape, and I talk to people on the North Shore, and I actually just had a conversation with Salem Mayor Kim Driscoll, for whom the month of October is kind of a big deal. The thing I hear over and over again, especially from the hospitality folks, is that their year turned out to actually be pretty good. And a big part of that reason was because they had a lot of folks who came here from other parts of the country because Massachusetts, quote unquote, got it right on COVID, and they felt safe coming here. A lot of that has to do with the work of this organization and the people it represents. We're very grateful for your leadership. We're very grateful for your support. And I absolutely believe you have a lot to do with why we will come out of this, and we will come out of it strong and better for it. Thank you.
Thank you, Governor Baker. I'm Lauren Peters, Undersecretary for Health Policy at the Executive Office of Health and Human Services. As the governor said, Secretary Sudders truly brought it all to the fight against COVID, so much so that she has lost her voice at the moment. So I'm stepping in on her behalf to share with you her thanks. To David Martin and the Massachusetts Health Council, as Governor Baker said, your partnership has been invaluable. Thank you for all you do to support health and equity in our communities. Secretary Sudders is grateful for this award, but accepts it on behalf of all of those who have helped carry Massachusetts through this pandemic, especially our providers, partners, families, and all residents of the Commonwealth. Your resilience and grit are an inspiration and are a major reason Massachusetts has reached this point, leading the nation in vaccines, addressing equity, and starting to see this pandemic shift to an endemic where it can be managed and controlled. Congratulations also to today's other honorees, Dr. Walensky, Dr. Muir, and the research community at BIDMC, a truly outstanding group of individuals dedicated to serving others. On behalf of Secretary Sudders, thank you again for this award. Take care, and we look forward to gathering in person again soon.
I want to thank Governor Baker for his presentation and congratulate Secretary Sudders for her good work and the accomplishments of the COVID-19 Response Command Center. Beth Israel Deaconess Medical Center's research community has been a key part of the ongoing fight to emerge from this pandemic, from strengthening diagnostics and treatment of the disease to developing one of the 3 FDA-approved vaccines. These discoveries truly got us through the worst of the pandemic. The Beth Israel Deaconess Medical Center community is also playing an instrumental role in large-scale clinical trials on COVID-19. Here to accept this award on behalf of the research community at Beth Israel Deaconess Medical Center is Dr. G Zabo. Dr. Szabo began her tenure as Chief Academic Officer for Beth Israel Deaconess Medical Center and the Beth Israel Lahey Health System in July of 2019. She oversees the medical centers and the systems and the robust research and teaching programs. An internationally recognized physician, scientist, and a leader in the field of liver diseases, Dr. Szabo brings to BIDMC passion and expertise that is instrumental to their reputation for excellence in patient-centered care, discoveries, and education. We know that Beth Israel Deaconess Medical Center research community will continue to lead the way out of this pandemic, and for that, we are grateful and we honor Dr. Szabo and the entire Beth Israel Deaconess Medical Center community for their many achievements.
Thank you, Dr. Motley. On behalf of the entire Beth Israel Deaconess Medical Center research community, it is an honor to accept this Shining Star Research Award. When the threat of COVID-19 emerged early last year, we at BIDMC became leaders in the national response to the pandemic, not only in our clinics, where our physicians and staff provided life-saving care, but also behind the scenes, where our scientists mobilized to develop solutions to the multiple challenges posed by the pandemic. Our clinical and research community responded to COVID-19 through collaboration and with a commitment to innovation that define us as an organization. To name just a handful of projects launched by BIDMC's clinical investigators. As early as March 2020, Dr. Katie Stevenson, Director of Clinical Trials in BIDMC's Center for Virology and Vaccine Research, launched trials evaluating remdesivir for treatment of severe COVID-19. Dr. Nate Shapiro, Professor of Emergency Medicine at BIDMC, spearheaded national study testing whether another well-known antiviral could prevent the onset of severe clinical symptoms in non-hospitalized patients with COVID-19. Altogether, BIDMC enrolled patients in more than 25 clinical trials related to COVID-19. Meanwhile, Dr. James Kirby, Medical Director of Microbiology, quickly developed a test for clinical diagnosis of COVID-19, making BIDMC one of the first medical centers in the nation to implement a high-throughput in-house test. That expanded testing capacity made another looming crisis apparent, a shortage of nasal sampling swabs that hampered efforts to test for and track the spread of the virus. Kirby's colleague, Rami Arnott, Associate Director of the Clinical Microbiology Laboratories, pulled together a multidisciplinary team to develop 3D printable swabs for COVID-19 testing to address this shortage. And finally, Dr. Dan Baruch, Director of the Center for Virology and Vaccine Research, and his team designed the COVID-19 vaccine candidate developed by Johnson & Johnson to become one of the 3 vaccines available in the United States. Since the FDA authorized its use in February of this year, more than 14 million Americans have rolled up their sleeves to receive the J&J shot that had its origins right here at BIDMC. As Chief Academic Officer, I couldn't be prouder of our research and clinical community's commitment to the innovation and problem solving that will help end this pandemic and prepare Massachusetts, the United States, and the world for the next challenge that emerges. Thank you.
Congratulations to Dr. Szabo and the research community at BIDMC. Everything you do every day gets us closer to living life without the shadow of COVID-19. Mass General Brigham is being honored with the Shining Star Award, representing all acute care teams. People in frightening numbers became sick with COVID. These individuals who got sick were treated by some of the finest institutions and caregivers in the country. We honor all of our caregivers and want to spotlight the good people at Mass General Brigham and their medical teams who selflessly took care of the very sick COVID patients throughout the pandemic. We honor Mass General and we honor all of the tireless caregivers who worked to help the sickest of the sick on their COVID floors and the people who work on COVID floors everywhere. Please welcome Dr. Kathryn Hibbert and Nurse Jeanette Livelo from Mass General Hospital.
On behalf of everybody here at Mass General, I just want to thank the Massachusetts Health Council for this award. It's an incredible honor to accept it on behalf of all of the healthcare workers and multi-professional teams that were on the front lines and continue to be on the front lines during the pandemic. And as you'll hear from Jeanette Livelo coming up, it really has been a team effort throughout. At the very beginning of the pandemic, we quickly realized this would be a once-in-a-lifetime challenge and also an opportunity to work together, to grow, and to care for patients, which is at the very heart of our mission. So thank you again for this award. It's incredibly meaningful, and we really appreciate it.
Thank you for this opportunity to speak. In retrospect, The COVID-19 pandemic came fast and furious in Boston 19 months ago. In less than 2 weeks after the outbreak, the ICUs were full of COVID patients and floors began to see them as well. In the beginning, the most challenging part is not having enough personal protective equipment and not knowing enough about the disease. There is fear and anxiety among nurses and healthcare professionals, fear of our safety and that of our families. I finally realized how severe this pandemic was when I got sick. Being critically ill with COVID was an absolute nightmare. Waking up in an intensive care unit, intubated, confused, delirious, and scared. Yet I had nurses and healthcare team members who remained steadfast and skillful, compassionate and kind to all patients and family members. They rose to the challenge with strength, grit, and resilience. I was inspired to get better by then. Given the second lease in life, I was inspired to get back, to give back, to help and support the nurses, build up their strength, and never give up. But never have we been challenged in healthcare as we have now. The pandemic continues. There was a roller coaster of emotion as nurses continued to advocate what was best for the patients and each other. We needed to reassess how to cultivate resilience among healthcare workers. Nurses knew we had each other. We draw strength from one another and learned to devise ways to build resilience. The staff began to put closure and healing and came together with artwork, music, songs, pictures, cards, and simply helping each other, embracing self-care and promoting excellence every day. It was encouraging to see what was unfolding, and I know then that there was a light at the end of the tunnel. I am honored to be accepting this award on behalf of the nurses and multidisciplinary team members at Mass General, the frontliners in acute care who continued to deliver excellent care throughout the pandemic. I want to thank the Massachusetts Health Council wholeheartedly for recognizing the tireless efforts of the healthcare workers with this award. Thank you very much.
Thank you, Dr. Hibbert and Nurse Livelo. We thank you and the acute care teams everywhere for your amazing efforts. Navigating the healthcare systems can be daunting. While doctors worked in hospitals for long, exhausting hours, when we were all learning about what COVID was and how devastating it could be, doctors were also in our neighborhoods and in community health centers, also facing the challenges that COVID presented. Boots on the ground is an old term, but these brave healthcare professionals were truly boots on the ground. Dr. Julita exemplifies what a primary care physician can be in this new era of telehealth. Dr. Mir reaches through the limitations of computer communication and lets her patients know that she is there for them whenever and for whatever they need. We're going to hear a brief testimonial from two of Dr. Mir's patients. Dr. Marisol Figuera is from Venezuela and a doctor here. During the pandemic, she was treating family at home via telehealth, and then in November, got COVID herself. She shares her brief story of the personal care and support she received from Dr. Mir that means so much in a time of telehealth care. My Lai was living in a small apartment with 10 family members when both she and her husband got COVID. Concerned with keeping everyone safe and getting healthy herself, My Lai was grateful to have Dr. Mir by her side. Dr. Mir was steadfast in her communication with My Lai electronically, getting her through these terrifying times. These are just two examples of the Herculean feats our doctors in the neighborhoods have achieved in these tough and challenging times. And now, let's hear from My Lai and Marysou.
From the first day that we heard about COVID pandemic, my first thought was, we are going to die. There is no PPE, we are going to die. And I didn't even have my will done. And so I told my husband, we are really going to die here alone in this country because we don't have anybody. However, 9 months passed and I got COVID in November. I just had clear throat, and then I said, oh my God, I have it. So I test myself, always with the support of my primary care. My doctor will call me 2 or 3 times per day, and she was always, okay, how are you doing? Are you okay? Is your husband okay? So I had support, and I know that if I had getting sick, she will have helped me to get into care. From the personal point of view, yes, it is always very good to have somebody that is your doctor and you trust. And from the point of view that I am a primary care doctor too, I know that many of the patients, everybody tells them, yes, you had COVID, you are going to be fine. They just trust the primary care. And just a quick phone call to your patient will ease their anxiety and will improve them. And that's what happened to me.
And at the beginning, when I sick, I don't know who I can tag them, because I know I don't want to bother them, because I know they are busy too. Dr. Me were busy too, but she is the one texting me first. Yeah, asking me how I'm doing and what she can do for me. I was so worried, and I was looking like someone who can help, but I don't want to bother the doctor who are very busy, I don't want to bother everyone. But until Dr. Me text me, and then my feeling calm it down, because I know I had the doctor next to me, I can text her anytime. Yeah, I can text her anytime or ask any question I need. That's why I'm very, very thank you and very blessing to her.
It is a great honor to be here today, and I want to thank the Massachusetts Health Council for this recognition. You have been protecting the health of our most vulnerable residents since 1920. We're lucky to have you. Thanks for all you do. I want to also thank Secretary Sudders for all her work. It is during challenging times that leaders demonstrate their character. Thanks for all you do. And of course, congratulations to Dr. Rochelle Walensky. We're so lucky to have you leading the CDC. As I said when I heard about the award, this is a recognition to the clinicians and other care team members that for about 18 months have worked day in and day out to care for the health of the Massachusetts residents. This pandemic has brought many challenges and has affected everyone in our communities. Data has shown that particular groups were disproportionately affected by the disease, by the financial challenges, and the consequences will probably be felt for years to come. Let's not forget that. I want to particularly call out my colleagues at Community Care Cooperative and all the community health centers across the Commonwealth, who have embraced change and innovation, who have jumped on early morning calls, late night calls to share best practices, to help each other develop workflows, and mostly who have supported each other from the very hard work we ought to do, keeping people healthy and making them feel we were there and on this together, assuring them we would be there to navigate their challenges. We have built an even stronger community. Finally, I want to highlight all the work in the telehealth space. I thank our state leaders for rapidly issuing policies that allowed practices to quickly pivot to provide virtual care, and I'm convinced that this will remain part of our model of care moving forward. It is up to us to ensure this modality is available to everyone and that we don't create more inequities or add more barriers. As I always say, the most important lessons I have learned were not in med school, but were from my patients, and it is to them who I dedicate this award today. Thank you.
Dr. Meir, thank you. Thank you for the standards you set and the personal, caring way you treat your patients. You make telehealth personal, nurturing, and professional. In times of national and international critical events, we look to our leaders for direction and guidance. Dr. Rochelle P. Walensky is one of those stalwart leaders who leads us with intelligence, compassion, and the fierceness of believing in the science and technology that will end the hold that COVID has upon the planet. Dr. Walensky served as chief of the Division of Infectious Diseases at Massachusetts General Hospital from 2017 to 2020, and professor of medicine at Harvard Medical School from 2012 to 2020. She has served on the front line of the COVID-19 pandemic, collaborating with the Massachusetts COVID response team. She has conducted research on vaccine delivery and strategies to reach underserved communities. She is the 19th director of the Centers for Disease Control and Prevention and the 9th administrator of the Agency for Toxic Substances and Disease Registry. She's an influential scholar whose pioneering research has helped advance the national and global response to HIV/AIDS. Dr. Walensky is also a well-respected expert on the value of testing and treatment of deadly viruses. It is my pleasure to present the final Shining Star Award for 2021 to Dr. Rochelle Walensky. Thank you for all of the good work you and your peers do every day to keep the residents of the Commonwealth and the planet healthy.
Thank you, Dr. Motley, for that generous introduction. It is truly an honor to be one of the recipients of this year's 2021 Massachusetts Health Council Health Care Shining Star Awards. I'm humbled to be chosen for this honor and accept this award, recognizing that I stand on the shoulders of so many whose teachings I have benefited from, whose stamina I have emulated, and whose wisdom has shaped the work I do today. Please know I share this award with each of them and with all of you. I am sure every member of the Massachusetts Health Council can remember when COVID first touched their lives. For me, it was about 10 a.m. on Friday, March 6, 2020. I was in my job as the chief of the Division of Infectious Diseases at Massachusetts General Hospital, and my pager went off, alerting me that we had the first case of COVID-19, indeed cases, in Massachusetts. They were related to the Biogen outbreak, and after that initial page, everything changed. I had the privilege of working with our hospital, our city, our governor, as we learned together how we could safeguard our community. Certainly at the time, I had no idea I would be asked to be the 19th director of CDC in the midst of the largest global public health crisis of our lifetime. When I became CDC director, I came as a practicing physician, treating patients who had to make the impossible choice between filling a prescription and ensuring they had food on their plates. I have witnessed firsthand the impact of health inequities on individuals and families with little or no access to regular health care. I also came as a scientist, aware of the power of research and data to drive policy changes that address disparities. I will never forget early in the pandemic when I told a patient that he and his family would have to quarantine, stay at home and away from others as much as possible for 2 weeks. In that moment, that definition of quarantine, I understood that what we considered a simple COVID public health measure was, in fact, a privilege. I have never again used that word without thinking to myself, I wonder if they can. In April, 10 weeks after becoming CDC director, I declared racism a serious public health threat that directly affects the well-being of millions of Americans and, as a result, affects the health of our entire nation. It was important to me to bring my passion and advocacy for health equity to my role as director of the agency charged with protecting the health of all Americans. Of course, CDC has long recognized that racism is the root cause of many health disparities. That April declaration made it clear that we were recommitting ourselves to the work of addressing the challenges driven by structural factors, racism, discrimination, and historical disenfranchisement that deeply impact the communities we live in. I know the Massachusetts Health Council has been a leading force in this fight. Just as I recognize that quarantine was a privilege, you recognize that our state's directive in March 2020 for non-essential employees to work from home revealed a divide in the workforce between those able to shelter in place and those whose economic livelihood required that they continue to show up in person. When vaccines became available, MHC launched the Vaccine Education and Equity Project, and quickly constructed a website to address vaccine misinformation with a focus on issues specifically related to communities of color, including our nation's history of medical racism. Even before vaccines became available, MHC mobilized our community's most trusted messengers, including Reverend Liz Walker, Reverend and physician Gloria White-Hammond, and David Ortiz to deliver messages of confidence and trust in the upcoming vaccine via radio and social media advertising. You worked with the American Nurses Association of Massachusetts, producing resources addressing community questions and concerns. We all know what a toll the pandemic has had on our collective mental health, including our young people. Working alongside the Massachusetts Association of Mental Health, you held mental health awareness contests for middle and high school students. The creative and artistic outlet helped kids see others who were also feeling the weight of this pandemic. Your high school-based public health forums are helping students understand how they can impact their own health and that of their community. And you hosted vaccine events, providing food, entertainment, and vaccines to community members in Dorchester, Roxbury, Lawrence, Springfield, Brockton, Fall River, New Bedford, Holyoke, Haverhill, Lowell, and Attleboro, helping to get shots into arms and hold conversations about community concerns. Thank you for being here with me and with CDC in this work. Thank you for working to untangle the thorniest problems in our society, for leading the way in the fight for equity, economic mobility, connectedness, and for so many other societal needs. Thank you, in truth, for sharing some of your most talented colleagues with me, who have become some of my nearest and dearest mentors, colleagues, collaborators, and friends. And thank you for working with CDC to create meaningful change. And thank you again for honoring me with this award.
That concludes our program, and I want to wish a final congratulations to all of our honorees, and thank Dr. Motley for emceeing our event with all of his well-known charm and charisma, Governor Baker for his kind words about the honorees and the work of the Mass Health Council, and thank you to our gold sponsor, Unicare. I also want to say a big thank you to the board of the Massachusetts Health Council, the planning committee for these awards, and finally, and most importantly, the staff of the MHC, Phyllis and Stephanie. Thanks to all of you.